Our paper is titled Latinx Mental Health Scholars' Experiences with Cultural Adaptation and Implementation of Systemic Family Interventions. I'm Daniel Cooper, doctoral candidate in the Family Social Science Department at the University of Minnesota. My co-authors are Elizabeth Wieling, Melanie Domenech Rodríguez, Diego Garcia-Huidobro, Ana Baumann, Anilena Mejia, Huynh-Nhu, Esteban Cardemil, and Ignacio Acevedo-Polakovich. Imagine that you just moved to a new country. You left everything you knew behind: your friends, your family, your work, your culture, the place that you grew up. You're starting over to create a better life for you and your children. You have to learn a new language, find a job, a new community, and learn the ways of a new culture. These are the types of challenges that many Latinx immigrants face after migrating to the U.S. Some families may go on to develop mental health problems in response to these changes. A number of mental health interventions have been adapted for Latinx immigrant families. However, it can be challenging to adapt interventions to address the various stressors that Latinx immigrants are facing. So we were curious about the experiences of researchers engaging in adapting and implementing mental health interventions with Latinx families. We hope this article can provide a roadmap for researchers interested in adapting evidence-based mental health interventions with Latinx families. So our primary research questions were, number one, how do Latinx scholars experience barriers in cultural adaptation research with Latinx families? And two, how have they been able to make progress towards overcoming those barriers? We interviewed 12 Latinx mental health scholars, primarily working in the U.S. context. All participants were faculty in social science departments, and most of them had at least 10 publications and over 5 years in the field. Interventions were directed at improving parenting skills, child conduct, or family functioning. In the results section, we discussed participants' responses and the major themes that arose. Participants experienced barriers on individual levels, on institutional levels, governmental levels, and sociocultural levels. We also present the major strategies that participants identified as being most helpful in overcoming those barriers. One example is training community members to deliver the intervention instead of having people outside of the community come in and deliver them. So if you would like to learn more about our work or continue the conversation, please contact me by email at coope707@umn.edu. Thank you again to all my co-authors, the participants in this study, and Family Process for giving us this platform to share our findings. Thank you for listening.